will be good to press.
Good morning, dear teachers. Welcome to the training today. So you all kind of know that what is the training today about. Have you all know what's training today? Yes, it's regarding first aid and CPR. Okay, so before I go into my training today, I'll first tell you a little bit about myself. Why am I giving this training today? Okay, so I'm Dr. Navin, a medical doctor. I've practiced for about 12 years in Malaysia. So I mainly focus on wellness and preventive medicine. So what about preventive medicine is going to be prevent something before it's happening. For example, I'm coming here today telling you about first aid, telling you about CPR. So it's to give a little bit awareness to all of you as teachers in your setting, as you are handling kids every day, as well as you can use this outside. You can go out, you can train your fellow friends, you can tell them the information on what to do. Or maybe later you see someone fell down or some wounded. You know what to do yourself to give a little bit awareness to you. Okay? Any questions for now? No. Good? Okay. So, I usually advocate the importance and knowledge in CPR. As you know, most of us know what is CPR, cardiopulmonary resuscitation, but how to perform it. We often see many different kinds of way or technique people are performing it, but which is right, which is wrong. So that we will go in depth on that today, so you would know how to correctly perform a CPR and how to give first aid based on the situation. Okay? This is just me during the COVID season. Why I chose this picture is because it shows prevention. This is when I think all of us went through the COVID phase, right? Where we used to sanitize. I used to be called to some teaching centers, some childcare centers, where we go and sanitize every day. So that's a part of prevention. Okay. So just a little bit quote on why first aid is important. So there's this guy called Petran and Koa. He told that we cannot stop natural disasters. Okay? But we can arm ourselves with the knowledge so many lives will not be lost. For example, we have seen many natural disasters recently, floods, earthquakes. We are blessed that our country doesn't have bad hurricanes or something. But we have seen many instances of floods recently. So do you know what to do if you see someone during the flood? Someone who might have an open wound. No. See, we know that we have to give first aid, but how? What? Or you know you want to go and help, what do you need to bring? Every single detail matters. It saves lives. Okay? Fine so far? Fine. So, this is a little bit statistics on this topic today. I'm making the statistics more towards your settings. So, according to recent global data, 20 to 23% cases that have attended the pediatric emergency department occur in the school environment. So 20%, that's a fourth of cases. So that's a lot. So if you can help prevent that here, or give basic first aid, you can help the kid. Many can be done. We can prevent life loss. Okay? So, for training level, there are studies show that only 47 to 55% of primary school teachers actually have received a formal first aid training. So that's half of teachers. For me as a doctor, it's alarming data. So I want to try to equip as many teachers as I can, so you as a teacher know what to do. Because you are the one who's going to see the child first, you are the one who's going to bring him to the hospital. So it's better for you to be equipped. Okay? So only 14.9% of teachers have high level first aid knowledge. What we mean by high level first aid knowledge is uses of bandage, how to splint. That's high level, I mean it's more specific. We don't dwell that much, but at least you have a basic. Okay? So first aid provision. This is alarming. I know that the ministry has had the rules that every school has to have a first aid kit, but look at that. Only 55% of school actually have a first aid kit. There are places that the kit is there. No one knows where is it. No one knows what is in the first aid kit. So how are you going to use it? See, when something happens, as humans, we panic. And when you panic, you do not get to recall. So by frequent trainings, it's embedded in you that you know at the time that happens, you know what to do, where to do, what to take. So that is what I'm trying to give. Okay? If you have any questions in between, just raise up your hand or ask me. I'm happy to engage on it. Okay? So, what is first aid? Miss, what's your name?
Sharon.
Miss Sharon, okay. Can you just give me a rough what is first aid?
The person is injured. We need to first thing we need to clean the wound and put the yellow medicine and we can give bandage for the person. Then we ask the person or we can bring them to the hospital or clinics.
Okay. So by basic terms, first aid is the first thing you do to help. Okay. So before I go into the topic deep, it's a Saturday morning. I'm sure you all of you have plans today, right? So let's go a little bit on some ice breaking session. Get yourself going. Good. Okay. So I think you have been given a paper and a pen. I'll explain a little bit about ice breaking session today. Okay. Have you heard of this session? Two truths and a lie. Okay. You heard it? Have you done it before? No. Okay. Don't do it today. I guess all of you know each other here. You have been working together, right? Let's see how good you know each other. Okay? So, I want to create a relaxed environment for you guys. Get to know each other, get going so we come into the topic. Okay? So, how do you do? I want each of you to write your name on the paper, 3 statements about yourself. 3 things. 2 things have to be a lie or one. But here you can see, you can put 2 truths about yourself and 1 lie. So, you will share with the group and you will get someone random to tell which is the lie about one of you. Okay? Maybe you can take about 5 minutes. Is it okay for you or 10 minutes? Okay? Yeah, let's get going. So just to give a little bit of hint, you can choose on personal qualities, maybe your hobbies, anything. About your family. But make sure you are comfortable with what you are sharing. Okay. You're free to use the washroom if you need. You want to get some drink or anything, you just let me know. Yeah, you just have a relax session. Time? You can take another 5 minutes. Then 2 minute truths or 2 minute lies? Okay. Can be something funny. Something that the others will be judging. This is a lie. Also, it gets the others to know you better. So after today, they will know that, oh, okay, he's actually a lie about her. Maybe she don't like this or she like this. It just helps to break the day and help to get to know each other. Is it okay? You ready to start? 2 more minutes. Okay, done. Okay. So, what we can do, you choose one by one person. Each person can introduce themselves, little bit maybe something about themselves, and they will state their 3 statements. So the others will have to point out the line. Good? You guys understand how it goes? Okay, so who would go first? Yeah, I think she finished first, yes, good. Yeah.
My name is Madam Shah. So, working as a teacher. My first statement, I tried to break my brother's age at 6.
Brother's head.
Second statement, I love to collect t-shirts. Third statement, I love to listen human songs.
By meaning of you broke your brother's head, what did you mean by that? Maybe the others will get scared.
Something he triggered me, so like point ourselves.
So it's like you accidentally.
Not accidentally, purposely.
I think you really need first aid training here.
The third one, what song?
Human Shankar Raja is a music director's songs.
You mentioned that Hindi has it, right? You're right.
Do you know Ilayaraja the king? The son. Ilayaraja's son, Human Shankar Raja.
Okay, so let's see who's going to.
First one is the line.
Okay, you,
First one is the life.
Miss.
First one.
Okay.
Good.
First, which one? First one is the truth.
First one.
So which is the lie?
The second one.
What was the second one just now?
I love to collect seashells.
Okay, so which one is the lie?
Second one is the life.
Oh, good. So you didn't try to break your brother's head.
Our age when I played bicycle, it was triggered me. When putting stones in my bicycle wheels, and I said, okay, I take the monkey, the top.
You knocked on me. Okay, okay. I was worried. Your statement sounds more like you were like. Okay.
It's quite very.
See, we need first aid training. Okay, so second one. Miss, you look all smiley. So maybe can you introduce to me yourself?
My name is Sharon. And my first one is I love to cook and bake. And my second one, I can swim very well. Third one, I like to eat vegetables. What? Vegetables.
So, Miss Madhu, which line? Third one.
Third one.
So all of you are going to the third one. You don't like vegetables, eh?
Second one. I would swim very well.
Then how yesterday you see the kids in the swimming pool, the first one with the John shirt. Swimming pool song.
So now you know your friend better, eh? That she likes to actually eat vegetables. So maybe next time if anyone doesn't like vegetable could possibly
Amazing.
So you should go for swimming training.
I've been go, but it's not like long time now.
The trainer quit.
The trainer passed away.
Okay. Miss, up to you.
Okay, my name is Paul. First statement is, I love my sister so much. Second, I love my students to ask me. Third one, I like to watch drama especially Indian drama series.
Third one. Third one. Third one.
So, which is like?
Correct. I don't like to watch the drama series.
Good. So, Miss, if you want to tell us in Malay, it's fine. No issues. Okay, she's a bit shy, so a friend helps there. No, can just tell us in. Come, just tell us in Malay. It's okay.
Kucing. Taking care of the grand mother dog.
Maybe you like to take care of your mother now. Okay. So, which one?
The second one.
Second one.
So, you don't like cats.
Second one.
So, Miss,
Hi, my name is Ruba. Okay, first one is I can draw beautiful portraits. Second one is I love sunset. Third one is I always wanted to be a car racer.
Third one.
so she likes sunset, she likes sunrise.
I don't know what she don't like sunset. She don't like the
So she likes sunset, and the third one she wanted to be a car racer.
Sun yang
car racer number one.
So which one?
Maybe second one.
Second one.
Third one.
Third one.
After correct, first one. It's a lie.
First one.
So what was the first one? Miss?
I can draw beautiful portraits. I cannot draw.
So from doing this activity, we know that there are lots of things we don't know for each other despite working every day with them. So it's just an icebreaker. Knowing better, you're getting laughing soon. So could we continue or do you want to take a break? Continue first. Good. Okay, let's go. So how was the icebreaker? Good. Okay. So we've gone through just now what is first aid, right? So now we'll see why is it important. Okay. So first aid is not only for falls. Many have the perception that they give first aid when someone has a fall or an accident. No, actually first aid covers many more. Burns, choking, even CPR is included in first aid. Okay? So this is what we are going to be learning today. Okay? I want you to later be able to state the common medical situations that happen in your school setting, distinguish an emergency and non-emergency, so you know which one is really an emergency, you taking straight to emergency services, which one that you can still observe around. Okay? Demonstrate the first aid action. I'll teach you, later we'll have a session where you'll be given mock drills to be doing an emergency situation. Where I'll give you a situation, you can answer me what would you do first. Okay, we'll learn that together. So we'll differentiate the techniques of chest compression used. I'll be teaching you adult as well. As you all are among adults, you might need to know adult CPR, child CPR as well. Okay? So, one of it that I want to guide you today is so that you'll be able to develop a medical emergency plan. So, in case there's something happens here, what do you do? So, you have a plan. Okay? Like I told you, you have a mock drill, we'll assess the situation, and we'll evaluate together the success and failure of the mock drill. So when someone does it, I will let you be the judge first on whether it's right or wrong. Then we'll go through it together what could have been done better, or if it's good, it's good. Yeah? Okay, so during the first aid, what happens? We prevent the escalation of injury. For example, there's a wound. Instead of the person moving his hands around, creating more bleeding, we split it. Prevent escalation, prevent it from getting worse. Okay? So it promotes the recovery. When it's not getting worse, the wound stays. You bandage it faster. It does not have infection. That promotes recovery. Okay? It protects the unconscious. Whenever the person is unconscious, protect him. You're not moving around for no reason. Often I see that happens. When someone's unconscious, they tend to move him, they carry him, they put him on a bed, they put him on a chair. So that's not right. So we need to know what is right, what is to be done. Okay? Provides pain relief when someone falls. But often they go through pain. So when you swing, for example, it reduces the pain. Okay? Finally, it saves lives. So, have you heard of the steps of first aid? No. Okay. So normally we go by the units of DRABC. Okay. Many of us have ABC. So there's two more in front that is usually not really told or not really seen, but is equally important. For example, when you see someone unconscious, when you're walking down, for example, someone is unconscious, what do? So usually the first always is the danger. You assess the situation. Look around. If you are coming to the place, you do not know actually why is he there fell. He's unconscious, you know that, but why? Danger usually helps both the responder, you, and the person you're responding to. I give you a rough situation as an example. You never know, maybe that guy has been electrocuted. You are going to help him, you go straight. But what happens to you? Who's going to help you if you get electrocuted with him? So that's where you assess danger. Look around, stop first, look. Is there anything? Is there a falling object? Maybe he fell for something and the thing is hovering above, waiting to fall. You go there, you might be injured. No, or accident. Assess for danger, which means is in the middle of the road. Are you in potential to be the next person in the accident? Often we hear in our news, a person goes to help someone, the accident ends up dying. Why? The importance of danger. You know that happened, find a way to get someone to help, someone close the place, or alert others to move away, slow down. That's danger. Okay, so often we clear the danger. If possible, take the body to the side, move the person from the danger itself. Okay, so as important as helping others, it's important to protect yourself. Okay. Response. Check for consciousness. Tap. Call the person's name, or if you know the name, or not just tap, uncle, get up. Are you okay? Get up. Then you know is he responsive, or he's half. So you know what to do next. So you know he's actually unresponsive. Okay? Check on the vitals. In this case, vitals is always, if you can check for a pulse, or hear for a pulse, or look for breathing. So usually look at him at the same level, or you can just put your finger on, find for any breathing, find for signs of life. Okay, so once you do that, you know that okay, this guy is unresponsive. So when you check, there's no heartbeat. If you know how to check here, or you can just listen to the no heartbeat, you know that okay, this is always going for CPR. You know what are you expecting to. Okay, so then we start your ABC. A is always airway. So you look, is there something blocking the airway? So open up the airway. I'll teach you all the techniques. You practice on the techniques. Okay? So breathing, check for respiratory rates. So you need to know when you're really clear, you check the airway is clear, then you see if the breathing better. Is there breathing or not? For example, you're choking, you already can open the airway, so you pull, you already open this breathe, there's airway when it starts to breathe. Okay, and see circulation. So when you already see there's no respiration, you don't see CPR. So always remember DRABC. Danger, response, airway, breathing, circulation. Okay? So, in the current situation, we always add on another word. Okay? So, we have seen the danger, We have seen the response, and always try to get S, which is set. What it means by that is asking for help. When you're alone, try to get someone for help. Call someone, help me, someone come. So while you are doing something, there is someone calling for emergency services. Tell them, please call 999. Get the ambulance coming. Or if you need to move the person to the side, call the come, help me, tolong. So there's someone helping you. You're not doing all by yourself. Because when you are going to give a chest compression, you can't be doing it all alone. You might need to take turns. Or you might need to move the person. Or for example, the person's breathing is fractured. You need someone to help him hold up so you can speak. You need help. So try to call help as fast as possible. Okay? Any questions? Let me know. Okay? So, I told you airway. Checking of the airway. Open up the airway. Okay? Breathing. So it's always you try to look for about 10 seconds. Take 10 seconds, look. Get at the chest level, look at the breathing. Okay? If no, go for CPR. Most places in Malaysia now, in public, we have the defibrillator. I will show you how to use defibrillator. So if you have a defibrillator, while waiting for it, ask someone to bring it. While they are coming, always look for a CPR. Anyone knows what actually CPR does? Why we need to give CPR?
To get the heart. Start the heart.
Okay, something like starting heart, yes. Okay. Michelle.
If we do CPR, the person can breathe and maybe he in conscious, he can breathe, then he can wake up and breathe. That's why we do CPR.
Miss Malu, right?
Defunction.
Okay. Yes. Michelle.
Somebody position. See first.
Okay. I mean, what's the function of CPR? The function of CPR.
Heart compression. Defibrillator. Can you go in very
All of you got the answer correct. There's no right, there's no wrong in this. All of you got your idea of it. Okay, so how CPR helps actually? When you are compressing the heart, you're helping the blood flow in and out the heart. Because in this case, the heart has stopped. It's not breathing, it's not having heartbeat. So before, we don't want a permanent, unreversible damage to the brain. Because oxygen is not flowing, blood is not going through. Okay? So when you are compressing, we call it 1/3 of compression. When you compress, you are pressing the blood to go out of the heart. When you let go, you are creating a vacuum, so the blood flows back in the heart. It's like you are a pump, external pump. So you press, it's the heart, you're pressing from top. Blood goes out. So when you let go, see what you do, you're CPR, right? When you let go, the same blood that's gone will be cashing back in. So that is where after 3 cycles, you're giving your breath. So you're also providing oxygen. So you're keeping the body, helping it as fast as possible to get back the needed oxygen to the brain. So there won't be any permanent, irreversible damage. So even that is why I said, even while you're waiting for defibrillator, start your CPR. If you are worried, you don't really feel anything, it's okay, start your CPR, it's good. So you're helping prevent damage. Even when AED comes, you're putting on the pad. Usually the AED will have where you put the pad for layman. So you put the pad, they will tell you, okay, they can shock or they will perform CPR. Your AED can help give shocks, but it's not going to give you CPR. So you still have to CPR the person because you need to manually pump until he regains his consciousness. much info. Okay. So, what are basic skills? CPR is basic skills. In the world today, CPR is taught among most caregivers, public servants, including police, nurses. Nurses, they know CPR. Even teachers in schools are starting to get CPR courses, especially in Europe. It has taking BLS basic life skill accreditation is a must. Okay. So, setting a spleen is one of the basic skills that will teach you how to set. Okay. So, spleen can be for fractures, can be for open wounds, swellings. You set a spleen to avoid movement. Okay. Stopping bleeding in dire situations. For example, in a school setting, when you think that one of your kids might have fallen and there's bleeding, you need to stop, because if you don't, that will lead to further complications. So how do we do it? How do we teach it? So how do you compress it? How do you bandage it? It's important to know. That could help you, because often in many situations, it's not due to the wound the person suffers, it's because of the blood loss and the time taken to actually seek emergency services. These are all the first aid. Okay, so for example, for bleeding, always apply pressure. If you're worried, you do not know who is it, you could always get a glove. If you're going to touch someone's blood, get a glove on, apply the bandage, press it. Okay. So once the wound has stopped bleeding, you can always bandage and try to avoid movement. Okay. Second one, burns. I'm sure we often see the traditional methods. There are people who put Colgate on a wound. There are some people I've seen, they put coffee beans, coffee powder, turmeric powder. What happens is going to give the medical emergency doctors more problems, more difficulties in removing those debris. And removing the debris is going to cause pain and more tissue damage. So the best way to do, the moment you know someone has burn, put that area under running water. Normal tap water. You don't need to be ice water, no, just normal tap running water moving on to cool down the skin to prevent further damage. Okay? So then you could wrap the area if you want. But always before wrapping the area, check if there's skin loss. What degree is the burn? If it's just a superficial burn, you can wrap it. If it's deep, you feel that you can't do it, so just leave it open and get to the emergency. But always first while waiting, running on cold, normal tap water. Okay? So fractures. Always the rule of a fracture is a spleen. If you have a spleen or not, anything could be a spleen. Anything that is hard, even a stick. And the golden rule is always to immobilize one joint above, one joint below. So for example, the fracture is here. Always immobilizing it this way. This way. Do not let them move. Okay? For example, it's the leg here. Your spleen has to go to here. It's not, if it's fractured here, it does not mean you just put the spleen here. No, you always have to go longer. Here, all the way to here. So he should not move his joint. Because now if he has a fracture here, and you allow him to move, fractures it. So always try to get anything, even the wood or box. Cut up some box, make it hard, put it on, then you make it. But always make sure the fracture is two types of fracture, close and open. If it's an open fracture, always do what we learned from the bleeding. Stop the bleeding first. Apply gauze. Bandage it, then you split it.
15 box
Yes.
or that, then we need to hold to make the line not move.
Yes, try not to let him move the joint.
Like cannot walk or cannot.
If his leg do not walk, if his hand try to punch his spleen, then he can lay down. I can hold it for him so he does not move.
So how if the person like adults or bigger than us or heavier or something, if we cannot bring like this to go to walk, so it means that how we can we need to have waiting for ambulance or something,
If
just like
it's
that.
going to be difficult, it's better he immobilize, he lie down or he sit. Depends on where's the fracture. If it's the leg one, let's let him lie down, but immobilize him. Often most fractures dislocate because of movement. So it create more problem because a fracture is like this. So when he moves. So what happens is it goes. So that's where more problem happens, more tissue damage happens. So we want to preserve instead of too much movement. So that in case if he needs operation, I think it does not move.
So how we want to recognize that one fracture for us as a person because we don't know that one fractures or we know
Anything. If you just feel okay, now for example your kids in the center, someone falls, you see there's already a swelling. You do not know it's fracture or not. One way to know is always by seeing is he moving the joint or neighbor or above. So you know there's fracture or is there anywhere you move then there's movement. But if you still can't assess, always do the safest. Split. Normally what I tell is that assume the worst. If you're not sure, just assume it's fractured, splint it, go to the hospital, let the doctor assess. Because damage is done if you think that it's not fractured, but actually it's a fracture. So it's better you just take it as a fracture, splint it, go x-ray, no fracture, then you're safe. Okay? So sprains, the same. If there's a sprain, always try to immobilize that joint only. It's a fracture, we told you that immobilize two joints. If it's a sprain, immobilize that joint. Try not to allow them to move. You can bandage the joint. Take them for imaging x-ray. Okay. For eye injuries can be from something to the eye or some chemical into the eye. Get clean water and irrigate. So always irrigate. Do not allow, for example, yours are kids, do not allow them to plug the eyes. That's the most important. Do not put any drops or anything that you do not know. The best way is always irrigate with clean water. Pour as much as water as possible, wash off the eye while taking them to the emergency. For eye, it's always the best to seek medical treatment. Okay? So, choking. When you see someone choking, always first check whether you can remove the antidote. Okay? Try to see it. If they can't be removed, always go for the handling maneuver. I will teach you. First hand later how to do handling and how to do for kids. They have to enjoy. Okay? So CPR, same like we do in DRABC, chest compressions. But to do so CPR is always if you see the person is unconscious, not breathing, your chest has no any signs of breath, no any circulation, straight go to CPR. Okay? Wash, irrigate first. Always, often is you remove and you drop them because you do not know there's any other area that has been heat by hot water. You remove the clothes. Remove it, get cool down to the yes. So that is to cool down the skin to reduce further damage. After that, do not apply any creams or anything if you don't have. Just regular. If you do not know how deep is it and how, but unless you just wait, apply very light bandage. Do not too tight because you might end up when you remove the bandage, actually So always cool down the skin first. Okay. I've heard this before about Miss Madhu, right? Okay. About wrapping with banana leaf. I've actually took the liberty of checking. Mostly the aboriginals, the orang asli does this. Why banana leaf? I found out is because banana leaf is very smooth. It has like a wax layer. So the aborigines found that when they left someone that has burned or any wounds in banana leaf, it does not stick on the wound because of the layer. If you see, you pour water on it, it just passes it. But in today's modern medicine, you do not know the banana leaf is clean or not. So there's always chances of infection.
Saya pun terkena dulu ada panas badan saya. Masa tu benar lift umur pernah.
So that's the thing. Bagus tapi kita tak tahu bersih atau tidak. So source of infection can be there. So unless it's an area like you're in the deep, you need something to close, or the depth of the burn is quite deep, there's open wound bleeding, you need to close. That is survival. Then you can do it, but you can try to wash, just splash wash the banana leaf, close it on. That if it's absolutely needed.
I should leave for the work. Like now the modern medicine, we got the gel.
Yes.
For clean the wounds. But maybe those days or some villages, they have the gels, they just put the banana leaf.
Could be.
Especially the young banana.
Could be, that's a very good info. Could be. Because I'm not sure if you all have heard the most recent treatment of burns. They are actually using the skin of a fish. They say that it actually helps a lot. The collagen in there helps very fast. So it's back on how we perceive, on how we see. So it might help, but make sure it's clean. And if absolutely needed. We do not want, the main goal is do not want to cause further harm. From burn, it becomes infected, then you have more problems. So the first one that we said, reduce here, promote recovery, and prevent escalation of injury. So we don't want it. Person is already injured, we create a second injury by giving infection. So that's why one of the reasons why we wash. Cool down the skin, to remove any debris before it sticks. But often there's a lot of dust or dirt that sticks on the skin. And later once it dries, it creates difficulty in removing when we wash. So when you wash at that time, it helps to remove everything. Reduces pain later. Okay? There are a few types of bleeding injuries. Okay? One is amputation, which means you have a clean cut, everything's amputated. So usually in amputation, what we do is if you can find the part that's missing, you do not know if the doctor can fix it back or not, always wash it. Put it in a bag of ice. Same goes for the amputated part. Run it on water. If you have a gauze or anything that you can compress it tight. Stop the bleeding. Compress it tight. And always lift higher than your heart to reduce blood flow. So normally the issue is always about bleeding. And normally the amputation, time is good. Time is of the essence. The longer you wait, the harder it gets for the amputated part to be put together. But always make sure that the amputated part is clean and kept in ice. So the doctor later will judge whether the vascularity is good or not to put it back. Okay? So avulsion. What it means by avulsion is, it's part of skin, about there is something that's sliced. So you have the skin like a flap. That's what we call avulsion. So usually in avulsion as well, if you can wash the wound, just put your running water for a while, just really or anything, while waiting for those. Or what you can do, use it as fast as possible, apply pressure. Do not try to pull off the skin. I've seen, okay, they try to pull off the skin now. The problem is if the skin can be put together, you can stitch it. But if it's pulled off, you get a great wound which is bleeding, bigger surface area. So just close it, vanish, keep going. So remember that in all of these, the goal is to reduce bleeding, reduce blood loss. Okay? So we have crush injury, something heavy, fall on, that's crush. So in crush injury, normally it can be two ways. Either there's an open wound, or there's no open wound but it's crushed. So usually in crush injury, what we do, if there's an open wound, vanish the wound, immobilize. Treat it like a fracture. Immobilize it. So usually crush happens at the extremities, in this area. So it's straight, immobilize it. So the joint together. So immobilize it, bandage it, okay. So we have laceration. Laceration is normal cut, right? You cut a knife, then it's straight cut. Can be a clean cut, can be a jagged cut, but as long as it's a cut, it's called laceration. So it's the same. The principles are the same. These are the type of wound. Abrasion. Abrasion is normally like when you go on a motorbike or you fall on spots, you scrape. The skin is lost, there's bleeding. That's abrasion. Okay? Puncture. One thing I need to remind you in a puncture wound, unless you really have to remove the puncture item, if it's there, leave it, get treatment. Because we do not know whether the item, for example, is a knife or anything, has it hit an artery or a blood vessel. By you removing it, blood flows. So it's better to just keep it there, get to the emergency. After the X-ray or scan, they will decide that it can be removed. In all this, if there's a possibility, do not use loose cloths or dirty cloths. That increases the risk of infection. Try to get some clean gauze bandage, use it. Try to always try to get the emergency kit. Okay? So, this is one of the steps that I told you before. Let's go through again. Number one, use protection. In situations that are possible, your emergency kit has, I'll show you the emergency kit later. It has gloves. If possible at that time, glove on first. Protect yourself. Unless you know the person, your spouse, or your brother, your sibling, your parents, it's fine. But in public, always protect yourself. Okay? Identify and examine. These are normally in cases where you have bleed. You want to help someone, always identify. Talk to the person. Okay, tell them, okay, are you okay? Can I help you? Get them to sit, then you start the treatment. Okay, I think you have heard, normally happens in other European countries and all where you help someone in a suit. So this is just to avoid that type of movement on the side that you're helping the person. Okay? So if there's bleeding, use direct pressure, act fast. Using your glove hand, apply direct pressure, put on the gauze, okay? Pressure it on. Okay? If the victim is able, that means they are aware, they are fully conscious, you want to go and get a bandage or get something, tell them to do it. Ask them, you can tell them, please can press here. While you go and get help or you go and get bandage or something. Do not let go. Okay, continuous pressure. Okay? And one other thing that you need to remember is the victim might go into shock if she or he has lost a lot of blood. So always keep an eye on how the person is the patient. Keeping in mind that keep conversations. While you are doing what you keep asking, are you okay? Do you feel dizzy? Are you feeling like fainting? We wouldn't want a situation where you are compressing and next you see the patient is unresponsive. That's delay. Okay? Last is always clean up. If you are in contact, you clean yourself up, clean the place up. Okay? Throw off the gloves and the use. Are we okay for now? You have the break? No. Okay. So maybe we can go for burns. Then we get a break. Okay. So these are the type of burns and scars. Okay. So we have a superficial, which we call a first degree burn. This is normally when you just when you're making a drink, you got scalded by hot water, be it this first degree burn. That means it's just over your skin, a redness. These are the 4 layers of skin. We call it the first one, the dermis, the epidermis, dermis, and we have the adipose tissue and the muscle. The first layer of skin. Then we have the epidermis, the dermis, second layer, and then we have adipose tissue. And I'm not sure if you've seen before when someone gets cut, you see that's a layer like a fat layer. Okay, that's the adipose tissue, and finally the muscle. Okay. So the first is always superficial, it is just over the top, redness, merah sahaja. Okay. Number 2, partial or second degree. Normally merah, and you have the bubbles, gelembung. So you know second degree. Do not try to move the bubbles. Let the doctor do that. Okay. So it could be second degree goes up to a bit towards in. There's bubbles, but it's only gone in. So that we need to do dressing in the hospital. When it's very more, I mean it forms more scar. Okay. So the third one is full thickness or third degree. It means it's already going up to inner dermis. Okay. Normally this one when you look at it, it's more like a very burnt, dry already, that area. So this one normally happens more onto, very rare you see these in hot water burns. Can happen if it's a continuous hot water. Normally the hot water just hit a bit, it's normally up to second degree. Third degree, the full thickness, very rare, normally happen due to steam and oil, higher temperature or burn. That means house fire, things like very prolonged exposure to the fire. So it starts to become dry because it's already gone deep, that the moisture at the area is sucked. Okay. So normally this has larger area and higher risk of infection because the barrier of your skin has been breached. So higher risk of infection. Usually in these kind of cases, there are some studies say that to apply wet towels or cloth on that area to keep it moist. So usually the fireman, the emergency department, they have something we call a fire blanket. So they put it on the person to cool the skin down fast. It's cold because it's already dry. You need to keep moisture. Okay. So the last and the worst, the fourth degree. Usually this is a very bad burn. Happens normally at burns involving factories, chemical areas, petroleum, which it's already all the way to the bone. So that is very bad. Usually this one you can probably, if you want to wait for the emergency, towels, wet it, put it on. One more reason why we apply wet towels and everything on them is to reduce loss of fluids. Because normally in this kind of cases, they lost a lot of water, fluid in their body. Because it's all with the bone. So always try to cover the area. Okay? And that is always need to be referred to emergency.
It's okay to wet the wound.
At that, because it's dry, and this one is already very dry. See, from the start, it's always water, and then we apply bandage because normally when it comes to the full thickness, the 4 degree, we try to keep that wet.
cool the skin down. So just put, normally what we do like in hospitals now we have gauze. We wrap the gauze with white top. Try to calm the area down to give it more moisture, avoid it to further loss of water retention.
So when you remove the clothes, does not stick the
Okay. Because if you see the difference, skin gone, already gone, all the way gone. So these two you have to go into operation theatre and remove. It's going to take long dressing. So from the start, what we told for these two parts is that they are worried we might remove. But this, you notice there's no more blisters. There's no blister because you don't try. Blister is when the hot water hits and then the water of our body goes out, becomes like water because of the heat. So our body's response is to push up. But this one is just trying. So you are trying to give the moisture. If you have extra questions, you can ask now, or can you save it for after the class? You can always meet me, ask me more. Okay? So, this is the basic one for burns and scars. Number one is always cool it down. With water, running water. Okay? That's why you call us for assistance. If you're not sure, you just, you know, okay, just a while, just wait, okay, water first. If you know it's going deep, call for assistance. Number two, you remove anything. For example, a watch, or there's jewelry, remove, because as the skin dries up, the skin is strong. That's one thing, especially always. It will be difficult to remove winter. Most of the time ends up the emergency thing. So at the start, better is to remove everything off while the water is running, remove. Clear up as much. We don't want this to create more ball by sticking back onto it. Okay. Third one, cover. So it's always cover the burn loosely, do not tight. With clean wrap or clean, damp, lint-free cloth. Lint-free, that means not lint-free. Have you seen certain types of bandages where when you remove there's so many long strands that is called lint. So we don't want that because it will be sticky. Later when you remove it's going to create more pain by pulling. We want something that when you remove, you make it wet, you remove is easy. Okay? So, seek for assistance. Do not, like I said, do not use alternatives. I've seen ice, I've seen butter, I've seen coffee, I've seen turmeric powder. Okay? Toothpaste, the most famous. It's always, do you know how difficult it is to remove the toothpaste later? Most of my patients end up crying not for the pain of the burn, but when we remove the toothpaste. When it dries, it becomes hard. And we have to make it wet and scrub it out. Okay? These do not cool the burn. Most of the time people say, oh, you need to cool down the burn, apply Colgate. No, it's going to burn later. Okay? So, this is an extra point for you in case of a fire. So always when there's a fire, stop, drop to the ground, cover your face and roll. There's a fire, okay? Cover. Always they didn't drop down because smoke rises. Down, you still have clean air. Okay? Try to get a fire blanket, smother the fire, move away from the heat source. This is just an extra point for you. Okay? We finished about burn. We'll go next to choking. I think we take some break. Okay? Anything you want to ask me, ask me the break or later. Okay? We take a 15 minutes break. Good.
No, today got no parking. I already put everything. I find. See, they say no need parking today. You all like yourself last. Okay. How was the swimming?
choose one as a group. Because after this we're going to do a mock drill. Alright, then I'm on here. So we can have discussion. So it's a very mild, let's say, was it a emulsion wound? Was it adults or was it laceration wound?
You can see that the shop of the
The bite,
eye,
very minimal bleed.
times go to become a bleed like really.
So what did you do for the wound? The first step.
This time you go and wash the kids and ice cube. You get ice cubes and put ice cube and you put the lotion and take drop. You want to
So you put the antiseptic lotion.
no, that is a different kind of lotion that we have.
Was it an antibacterial or antiseptic lotion? Because if you are going to use the ice, which you take it out from a refrigerator, which you store meat and everything, then it's not clean. But still, it's not clean if you're going to put it on the wound straight. You can put it a while, but you need to clean. Yeah, but you still need to clean the wound with the antiseptic lotion and close the wound.
This is the white color.
This is the body lotion.
We're using this lotion actually.
Okay, so in this case, let's ask the group B. What do you think should have been done in that situation that Miss Madhu has shared? What's the mistake they did?
The lotion and the ice.
In many cases, we apply ice to reduce swelling. That's okay. It's okay. But post applying the ice, you should clean it up again. So I think you apply antiseptic lotion like we have in the box, yellow lotion. Okay, or you call it iodine. You should apply that again because even if ice pack or not, you are keeping it in the refrigerator with many other things, so it's not clean. Okay, so you need to clean it back and then bandage. For their kids, you should bandage it to avoid contamination. And do not apply unknown lotions because you never know, there may be some other chemicals or fragrance in the lotion that could irritate the wound, cause more pain. And depends on the age of the kid, you might need to give the kid antidotes because of a bite. When the kid is young, he has taken before the tetanus shot, then might not be, but let the medical expert be the judge of that.
1 year. The baby.
Then don't need, but
3 years baby go and fight.
a small baby might have bigger complications. Maybe infections, saliva, so it depends as to a thin, loose wrap should do it. If you can, you see there's no more bleed. Would be circulation.
During my first year of working, so my life is this. This boy went to the toilet, so our toilet actually has a step, it's a highway step. So, and the kampung like sitting right this is crossing my toilet. So once the boy done his business, he wanted to come down, he jumped. But the thing is, he actually able to do things by himself. So I assumed that he can come down by himself properly. I turned my back, I walked.
Actually, the first aid, you can't say the first aid only happened at the clinic. No. The first aid, you did the first aid. Compression is only the first aid. You did not leave it open and run while the blood is pouring. No, you did your first aid compression. In your case, you can't clean the wound. You're not supposed to wash the wound and cause it, because you said the blood is oozing out. So you're not supposed to go and wash it more, and it's not going to stop you oozing. And it's a child. So you, and the area that he hit is sensitive. So all you can do is keep the child conscious, compress with anything you can get. At that moment, like you say a towel, it's okay, but keep constant pressure. Like I showed you one was like constant pressure by your palm. Pressure will stop the bleed. So at least by the time you go to the clinic or hospital, the bleed has stopped, then they can clean the wound. So keep the child not to move so much as well, because when you're pressing, if it's going to move too much, the wound is not going to stop. The bleed is going to, so immobilization and compression.
How if the child unconscious?
If the child is unconscious, pressure has to be there. Put everything that you can, push it, and CPR. Unconscious is always CPR. CPR until you get medical services. Okay, because you need to give artificial breaths and hydrophonic resuscitation. Okay. So let's do a mock drill. I'll be asking a few questions in this case. Maybe you can tell me how would you do it. You can take a partner and show, maybe. Okay. Who's going to do first? Any volunteers? You. Okay, good.
Talking.
Yes. So, you are now in a school setting. You have a kid of age 10. Okay, while having his food, he was playing around, and when you look, he was making grinding like sounds. What do you do? Maybe we can have this. You can show on your pen, so everyone here can see. Then I can correct your pen. So imagine she is choking. We start. Now she's choking. What do you do? So you said she's not responding.
Yes, because I'm checking so she can't answer. She's okay.
No. What it means by not responding means she's yes. So that's the difference. So that means she's responding, but she can't breathe or talk. Yes. Okay. You want to come over? Shoot that stuff. Okay. So where do you hit the blow? Okay. Okay. Your blow, your blow should be here. You should move from here, this way, move on. Okay? So it has to be here, is too high. Okay? If it's a habit, how you do it? Habit,
It can happen in an instant. 1 minute there's friendly conversation around council. Roughly 5,000 people die from choking each year. Josh Mockley, a male clinic cardiac nurse, says when you see someone choking, it's important to remain calm as you let them know you're about to help.
So you want to place the thumb side of your fist against the person's abdomen, and then you want to apply your hand on top of that. And
You're going to
then
use the pressure of this,
apply pressure
not here,
to
not this.
relieve the air.
It's
Yeah,
called
that's
a
the
Heimlich maneuver. 1, 2, 3. Mockley says to repeat the process until you see the object they're choking on come out of the person's mouth. 1, 2, 3.
So that's
Are you
fine.
okay?
You have to pressure. If you remove this thing,
Thank you so much. Yeah, you're
you won't
welcome.
have this
I feel
strength.
better.
If the person loses consciousness before the object comes out, make sure someone calls 911 for help while you continue to reach under the person's airway. 1, 2. For the Mayo Clinic Network, I'm Ian Roth.
So you push, but if you do like this, see, there's not much strength here. The strength is going to be here. So you're going to pull it down. You can press out 1, 2, 3. So you want you breathe in and pull. You push so that this part has to move here. The shoulder in. Okay. So, should we try one more activity? Since you went first, who do you want to choose? Okay. Okay. So, now you're in the school, there's a kid running. Suddenly he fell down. And he's crying and carrying his hand. He's just moving his hand and he's crying with the hand. What do you do? Okay. So, in this case, like what it says, okay, good, but now you do not know what happened. So, what are you to anticipate? Unless you know it's a fall, if there's a wound, it's fine. Okay. Okay. First, always must remember the child is addict. The child is keep crying. You need to calm the child down. So now you first, when you go to the child, you have a quick assessment. Any bleeding? What's important? Any bleeding? Any open wound? You see, okay, there is no open wound. The child is responsive. Because crying is responsive. So calm the child down. Get the child to sit. Okay, be calm. Sit. Call another teacher, and you want to help him. So when you calm the child down, you are looking. Is there any deformity? Anything broke or swelling maybe, or maybe he fall down, shoulder went down. So then you will know actually where's the problem. It's no point if you're going to spleen here. The problem is we have a fall, shoulder dislocated. So you're going to hold here, but you're moving here. So your mistake. Where is it? Because you assumed. What you did is right, immobilize, good, but where? So you need to calm the child down. Most important, make sure no open wound first, bleeding. If there's bleeding, tutup, close bleeding first. But if no bleeding, you have time a bit. Okay, ask the child, okay, what happened? Where is the pain? The child, oh, here. Then you know, you immobilize here. So no point. So you need to know where. Calm the child down, get help. Ask, where's the pain? What happened? Then you will know where's the pain. So if it's here, then yes, okay, both sides immobilize. Or use the triangular bandage to hold this part. So even if it's here, you are going to use a triangular bandage. Because you want to immobilize so it doesn't move. So you're going to put the bandage over.
That's a very good question because you guys are also handling autistic kids who are not lower, they're just going to cry. So in this case, try to reduce doing damage. So you know that the child fell down, this hand is moving or something, try to immobilize the whole thing. That means you triangular bandage. Like same, assess any open wounds, look for movements. Most important. So even the friends have they may move this. So you know that here he's moving, here maybe not. So triangular bandage it so that you have immobilized all. Take to the clinic. So maybe on the way he has reduced his calm, then you know where's the pain. So the doctor will assess every joint. So rather than you assuming and putting a splint here, bandaging here, but the problem was here or here. So you do it together. That's the best. Normally the first aid, the fundamentals are the same, but the application is based on situation. We splint, we immobilize, but where? So the best judge is you who are there. Okay? So, you all need another break or can we go for CPR? Can? Do you need coffee or anything? No. So, I'm giving a very basic CPR workshop. Okay? So, firstly, what is CPR? CPR or the long is cardiopulmonary resuscitation. Okay? It's a procedure that involves a manual chest compression. Okay? Artificial respiration, that means breathing. Okay? And defibrillation. Defibrillation is a medical term, but what it means is that there are certain type of heart problems where the heart is moving but not pumping. It's just moving too fast. So what are you doing is you are compressing it to reduce the movement to go back to normal. Okay? So that is how it is. It's like I told from the start. It's to maintain the blood circulation, maintain the oxygen supply. Okay? So to prevent irreversible brain damage because of lack of oxygen. So you are actually helping the heart to pump back the blood to pass on the oxygen. Okay? So most important is a prompt and correct CPR. I've seen a lot in movies. They're doing CPR. There's some of them actually pressing it down here. CPR in the stomach. Some of them CPR in the middle. It's so hard. What's the point? Okay. So by learning this at least, you can help someone. You might help someone one day. Okay. So as usual, we have gone through this previously. Because CPR is also a part of first aid. Okay, but it's taught in a different module because there's different fundamentals and in depth. Okay, because of the techniques. So as you heard just now, we saw check for response. When you see a person and always check, shake them, wake them up. Hello, hello, wake them. He's unresponsive. He's unconscious, so you need to try to wake him up. Because you want to know, is he unresponsive or is he sleeping? Or the worst case, you get he's drunk. So you wouldn't want to do CPR on someone who's actually just asleep. Okay. So second, if you're alone, call medical services. If there's someone with you, tell them, hey, call. So that person is handling the call and you are doing so. You are not wasting much time. Okay. So third one, check for breathing. So check for breathing is always what we do is when he's lying down, you can either stand beside him, look for the chest rise. Because normally you take about 10 seconds to look there to see is there any chest rise or not. So when you see there's nothing, start compression. Okay. So during the compression is very 30 to 2. 30 compression, 2 breathing. Okay, I will teach you the correct ways and everything to do it. Okay. So, and the final fundamental that I'm going to teach you is understanding the use of AED device. So, the first one is always tap and shout. If you know their name, call the name. If you don't know, it's okay. Check one, it's fine. Check for movement, check for breathing, any movement, even fingers or anything, check it. Call medical services. In the medical services, always inform them where and what happened. You will give them better idea how to come, how fast they supposed to come. Okay? So, when you are checking for breathing, it's always when the person is down to the floor, you tilt their head. The way to tilt this, you use your thumb here, push it back. Okay, we call it a head tilt and chin lift. There's another way that is you hold here and you lift the chin. This part. You can try. You put your two fingers down here, like this, and you tilt. So it's only head tilt. You tilt the head and lift the chin. So we call it head tilt and chin lift to buka. So it will extend the neck so the person can breathe if in case something is happened to the neck. Okay? So if the person is still not breathing, go for chest compression. Okay? So how you do it? Anyone knows? How do you place your hands? Okay. Always which hand is more comfortable? You put it on top, you create a pressure, one hand is open, one hand is closed. Okay, so you place the heel of one hand in the center of the chest. Here. Middle here. Place one, the other on top. Place the other hand on top of the first hand. Okay, interlock the fingers and strengthen your arms. So it's always you have to strengthen your arms, don't bend. Arms have to be straight. Okay, press down firmly and quickly. It's not 1, 2, 3. No, it's always 1, 2, 3, 4. If this part is moves, that means your back. I will show you. Okay, so it's always about 2 inches for a jump. So this depth. So your movement is just 1, 2, 3. That's the amount of depth you need to do. Just 2 inches, not too deep. So we always call it 1/3. Okay, so for a child about 1.5, you use the figure. The method is shown just now. Okay, allow the chest to return to the normal position first. Okay, every time you do it, do not push. 1, 2. That means allow it to come back up. A complete recoil, we call it. Because only then the blood will fully flow back into the heart chambers. Okay, so the ratio is always 100 or 120 per minute. That means about 2, almost 2 press per second. Okay, and it's only 30 to 2. So every 30 you have to count. 1, 2, 3. So it's 30, then you stop, give 2 breaths. Then you continue back. Okay? So, when you are going to perform a rescue breathing, okay, most of the emergency devices now, the first aid kit there is a plastic for you to apply on your face. Okay, but sometimes in medical situations we have the cup. We call it a mouthpiece to avoid mouth to mouth. Or unless you know the person, then you can eat mouth to mouth. Okay, so normally what you do, the moment you have done the CPR, you do what you do. And then you put a cup, you breathe in. 1, 2, you breathe in. Okay, we will look at the right side chest. When you breathe in the correct, the person's chest, when you breathe, you will in there and down. Now, because you are breathing in, you can see. Yeah, because you basically on the side of it. So you breathe in, no, you can see the chest rising. So the chest rise is important to show that you have correct breathing. That means correctly breathing, not going out. Okay? So after, see if the chest doesn't rise, re-tilt the head and try it. So you see the chest didn't go up. You tilt back again and then you breathe it back. Because sometimes you might have fluid here. So you do this, that's all fluid. So you tilt it, your passage is open. See, you down, you'll be hard to breathe, baby. It's hard for you to breathe, but you open up higher, you take better. So that's easier for you to give the breath. Okay? So, chest compression techniques. Both hands interlocked in between the nipples. Easy for you to see. Okay, so interlock in between the nipples. So, one hand down, chest compression. This one do this, and we do this. And you press it. I'll show you another demonstration for you. Children want to eat in between the nipple, but just one hand. So you do press just one hand, not you it's too strong. Okay? Infants, just below. The babies are small, just below. Two fingers. So the baby did like this. Normally, most of the time, infants are always either on the floor or you are here. So what you're doing is you're just pressing this way. 1, 2, 3, 4, 5. So the finger will go like this. So babies are soft. Their sternums are not strong yet. When you press, you will be able to see the movement better than how you see on the guts. So you just press. So remember, just repeat it. 1.5 each. 1, 2, 3, 4, 5, 6. Always keep the count. Okay? So it's always 30 compressions and 100 to 120 compressions a minute. So every second is about 1 to 2. So 2 per second. Okay? Remember, allow the chest to come. 1, 2, 3, 4. Not too fast is better. 2, 3, 4, 5. It doesn't come out. There's no point. So you have to 1, 2, 3, 4. So it has to go 2, 3, 4. That means out, in, out, in. No? In. No point. It defeats the purpose. Okay? So yes.
For the infant, so baby can be
Okay. So another thing that you need to do is minimize interruptions. So when you are doing the CPR, you just do the CPR. Try not to stop and tell someone something. No. Even if you've been doing anything, continue your CPR. Or if you're tired, change another person. Okay? This is a technique for the rescue breathing. So always ensure the airway is open. How you do that? Okay, so you have seen the activity live on. You have done on to your friend as well. So you felt it how and they had that ball that we did it. So you could feel somehow a bit of recoil. How is it? And your correct placement of your hands. So remember, always make sure straight. Okay. So let's go through together what we have done today. Okay. So maybe each of you can share. What do you think is the mistakes that commonly done when initiating a first response?
checking the surroundings.
Okay. You don't do it.
You are, yeah, they will
Okay.
check.
Don't check the surroundings, okay? Check.
Same goes. We won't check the surroundings too much. Straight away we go and attend the things what is
Okay. Okay, the technique of the CPR. Okay.
response. Always forget to ask the response.
Forget to ask the response. Okay. Okay, but that's before the CPR. That means you always forget to check the response of the patient first. Okay. Swedish? Hand position. Okay. Okay. And the hand position and pressing technique are mostly, I mean, it's already to the CPR level. Okay. So what normally the first one that I say, you forget to see the danger. So you straight go and respond. It's not wrong, but it might create bigger problems. Because when you see a person that's not responding, you will know what happened. Maybe he's electrocuted or something fell on him, or maybe there's a wild animal. You know, so always check your surrounding, and like you said, check first the person is awake or not. Check the response. If your first response can be from CPR, can be from your wounds. So like we said just now, ask for consent. Okay. Why do you think the good CPR technique is important? Okay, to save the life. Why? You can save any other way. Why must do correct CPR?
Make sure the blood flow and 100% conscious
Correct? Good.
heart.
Correct. So is to make sure the correct blood flow from the correct CPR technique. Okay. So the right way is the safe way, and the safe way is the only way. There's no shortcut, no other thing. Okay. So another one more is that remember, doing a thing the right way is more important than doing it the fast way. So like the CPR again, this doesn't mean you do fast 1, 2, 3, 4, 5, 6, 7, but you're having to do that. No point. End up, the person you try to save is not safe, and you go back with the sore body. Okay? So that is why, like I kept telling just now, good CPR method. Okay? So, I just summarize a bit again for you for today. We go through. Okay? So always remember DRS A, B, C, D. Okay? So all the doctors A, B, C, D. Okay? Again we go. Anyone wants to read the DRS? Is Madhu? Okay. So the defeat is the extra part. So always remember danger, response, self-help, airway, breathing, CPR. Then AED, go for it. Okay? So just now someone asked, until when will this CPR? I remember the question, right? So continue sequence until responsiveness. So responsive, I showed you how the left lateral thing. Okay, moving to the side, because in case there's any choking, anything stuck, because when you CPR, maybe saliva, you go out. Okay, one is better, then you can turn it back. Or normal breathing returns, or help arrives. In extreme situation, there's only 2%, help did not arrive after some time, you are tired, burnt out, then you have to stop. That's extreme situation. Okay. So same as the first aid, we saw this in the first slide just now. So this is just to recap back again. So breathing, always compress. Burn, always running water, clean. Okay. We go back to fracture. Always
Check what's the fracture, scandals,
okay. So empty. Okay, but one thing remember, fracture also there's open and closed fracture. Make sure it's not an open fracture. No bleeding. So if bleeding, always go back to bleeding first. Compress, then fracture. Split. Okay, with something hard, immobilizing. Okay, sprain, we immobilize the site. Which part is it? That is for sprain. So that they don't move that joint. You don't need to join the other side because it's only one joint. Okay? So you go back to eye injury, you irrigate with clean water, running clean water as much as possible, irrigate. Okay. Shock is the same. You move them aside, check for responsiveness, CPR. Shock could be electric shock, or even could be hypovolemic shock. That means if someone marathon, dehydrated, fall down shock. Always check for responsiveness, CPR. Okay. And one thing about shock is keep the person warm. Okay. Even they might get cold and calm because of no water. The person doing marathon, keep them warm. That's why they used to say marathon and before they put the blanket. When we saw the blanket just now, that is also for this. So you put that to help warm the body up. Okay. Choking, I said just now, we check for responsiveness, Heimlich maneuver, or for the kids, blow. Okay. And final one that we learned just now, CPR. We went through. What was the sequence? Yes, Dr. ABCD. Okay, so got it? Okay, any questions, anything you all still want to ask, anything confused between these?
So, choking,
Self-choking, usually try to just hit and try to go, that's all. Try to cough it. You will try to induce a cough. So you can't be doing technique, so it's just cough. That's it. Okay? So, let's go to a quiz. So, let's see. Any gifts to give? Okay, maybe who gets better correct can get a drink. Okay? So, for the first photo, it's a bleeding. Who wants to try? Which is right, which is wrong? The first one, this one. Is this correct? We have seen a lot of people when they have a bleed, especially in movie Rambo or Jason Statham, they have a bleeding here, they tie. Is it right?
This is right, but you need to wash the water first, clean water, and
But it's bleeding. It's bleeding.
compress first, then you get bandage.
But in this picture, if you look, what they're doing is they did not bandage at all. What they're doing is they're trying to tie the extremity. It's wrong because you do not know the bleeding is coming from the vein or from the artery. If it's from the vein, the more you compress, the more it will bleed. Okay, so the correct way is the second, which you compress. Whether it's artery or is it vein, the best way is always to compress at that area. Okay, remember I told you, so we can pump, press, and then bandage. Okay? Second one, Miss Madhu. What is wrong with the first picture? Correct. So the second one, running in, running water. Okay, good. So, CPR. The pictures almost the same time. This side is wrong. So you do not put pressure on your fingers. So this pressure goes this way. Because if you put pressure on your finger, it's going to push this finger in. So this one is just right there. So the pressure goes this way. Same as right, this is wrong. Okay. What is wrong with number one? What is it doing? Stepping, but it settled out. And that thing might not give enough pressure to help remove the foreign body. Okay? Okay. So, okay. Just to recap back with you, I will show you a video, short one, on CPR. So you can look at how CPR, then maybe you can ask me questions based on that as well. So we go through some, so that just keep your mind fresh. Okay?
Show you what to do if you see someone suddenly collapse and they don't seem to be responsive. First step, we're going to ensure that there is no danger. Then we're going to check for response from the person. We're going to ask them a few questions and we might actually even pinch their shoulders to see if they'll respond. Hello, can you hear me? What's your name? Squeeze my hands. This person is not responsive. So the next step is to send for help. The number in Australia to call emergency services is 000. At this stage, I would also encourage, as soon as bystander support arrives, for them to locate the nearest defibrillator and get that over to us as soon as possible. Next, we're going to check the person's airway. We're going to tilt their head back, open up their airway, and check if there's anything obstructing. No obstructions, we're going to check if this person is breathing. So we're going to look over the person's chest, and what we're looking for is that normal gentle rise that our chest does when we're breathing. We're going to listen for any sign of normal breathing, and you can also feel that chest for any sign of breathing. The person is not responsive and they are not breathing, or they're not breathing normally. So we need to start CPR. To locate where we're going to place our hands on the person's chest, we can go to their underarms with our pointer fingers coming to the centre of their chest, and then with the heel of our palm, we're going to place the hand down, keeping our arms straight, interlocking our other arm, leaning over the person's chest, and we are going to push.
So if you see here, just stop for a while. The hands are not actually down. See, it's just that, it's there. But the main pressure is at the up. And you see the hands? Straight. Okay?
Now we're actually going to push hard and fast. We're going to push about a third of that person's depth of their chest, and we're going to also allow for that chest to
See, as you say, allow the chest to rise back. Okay?
rise back to its normal position. Now we're pushing at a beat of about 100 to 120 compressions a minute.
See, the chest is coming back.
If we're willing and able, we can do rescue breaths. So to do a rescue breath, we're actually going to tilt the person's head back, pinch their nose, open up the airway, and I would put my mouth over the person's mouth, forming a seal, and I would offer 1 breath, 2 breaths, and then I would come back to my chest compression.
Just the breath. The mouth is tilted, she's looking at the chest. Okay? Then, continue back.
Now I'm getting a bit tired, so I'm going to get that bystander support. And I'm going to communicate really clearly for a smooth handover for minimal time off the chest. 1, 2, 3. And I'll take over again.
See, his hand is clear. You look at his hand. see very clear. Yes, I see. See? You see, there's actually you can see the shadow of the hand. That means hand is not touching. It is like that. The full pressure is at the palm. Okay? This is how you like if someone can help you. They go by.
Demonstrate how to do CPR. Our next video will demonstrate how to use a defibrillator. Don't forget, CPR can save a life. In this video, I'm going to demonstrate how to use a defibrillator.
There's a short
By this stage, you would have started CPR already. Once the defib arrives,
See, like I
you're
said,
going to turn it on
CPR start
and you're
while
going to
waiting
follow
for
the
the
prompts. The defib will give you really easy and clear instructions of what to do.
Remove all clothing from patient's chest. Pull red handle to reveal pads.
Now it's time to place the pads onto the person's bare chest.
Apply pads to their skin exactly as shown in the pictures. Place pads firmly.
At this point, the defibrillator will start analysing the person's heart rhythm.
Analyzing heart rhythm.
The defib will advise us to stand clear and it will advise a shock is being led. Step back from the patient and keep your hands in the air. That way, we're letting any bystanders know, do not touch.
Delivering shock. Shock delivered.
If a shock was not successful, we need to continue with CPR.
Provide chest compression
If I tell you,
support.
provide
The
chest
heel of the
compression.
hand should be in central chest. The other hand should be on top of first hand. Push down hard at least
Extend it to 1
5
feet.
centimeters. Stop chest compressions.
After 2 minutes of CPR, the defib will actually stop and analyse that person's heart rhythm again. If a shock was not successful, we'll need to continue with our CPR. If the shock is successful, you'll notice that the person is now responsive. Comfort them, leave the pads on, and wait for emergency services to arrive.
So, any questions from what we saw? This is just like a summary. Yeah.
I've heard this or seen, I can't remember. If they are, when in a very bad accident and the cage is broken, you still do CPR.
Yes. Yes.
Still. Will the
No matter what
pressure
happens,
seems different?
not really, there will be a bit of difference definitely, but our main goal here is to prolong any delay of oxygen being given. So even the rib cage broke, you continue. Even while CPR, you hear something breaking, you continue. Because the rib cage broke and any other complication like a punctured lung, anything can be cured. We can see that too later. But if you don't do a CPR because of that, the person actually dies. Yeah.
So I discuss basics. If for a woman, so they still remove clothes and you still put the pad and exit.
Because it's unresponsive. That is why we check responsive doctors. Because you still have to, because you are doing a life saving. Yes. So if possible, I mean, you remove it, but try not to have too much people around. Not the world today is different. So you just put the pad on and maybe just cover.
Or that is possible.
Yes. So then you want to be back to CPR. Okay. I have a few questions ask you to see how good or how much have you understood. So, I'll ask you the sequence, whether it's correct or not. Okay. So, the first thing you need to do when you see a person that's not responsive is start giving compression, and then they give breathing. Wrong. Good. So, which is the first? Okay, so it's always the DR, AB, C. Okay. So, when you're assessing someone, is it correct that you're supposed to adhere to a term called look, listen, and feel? Look, listen, feel. Yes. Good. So you always go for breathing, try to listen anything, and try to feel for any changes, bad parts. So it's always you're going to listen, feel. Good. Okay. And what is the correct compression rate? How how many actually?
One minute, 100 to 100.
Good. Okay. So for a child, what is the compression depth?
1.5.
1.5 inch. Okay. For adult, 2 inch. Good. Okay. So when you are alone and need to do a CPR, are you going to straight start CPR? Are you going to call emergency first? Are you going to assess the place first? Correct. So always assess the place first, then you know what is actually happening. Call. The best is if you can call or put it on speaker while doing and start the CPR. Do not delay your CPR. Okay. The breath. How many seconds apart? You're going to give 2 breaths. 1 and then how many seconds? Another 1 second. Okay, good. So overall, how do you feel? Do you have anything else you need to ask? Anything you need to know? All good? So, before we go to our last learning point, that is to create a emergency response for your own center, let's try to go through some basic questions to see how good have you understood today's learning. So, first one, CPR consists of which of the following components? All the above. Okay. Good. Okay. When beginning CPR, start with. Now let's go one by one, shall we? C. So it is always, like I said, is compression. Okay? See, the faster the better. So usually we start, get out. Okay? So only single rescuer. So we need to do. Okay? At what rate the chest compression in a minute? 100 to 120. Okay. So for adult, what's the compression depth?
2 inches. 8.
Sure.
Sure.
Good. After each compressions, what? 8. Okay. So the question maybe after each compression, each time you press, you allow recoil. Okay, so that's why do you allow the recoil? So maybe the question actually is there's not nothing like a wrong answer. It just depends on what you perceive from the question. Then some when you say check pause, where you thinking that okay, compression is the whole thing. Okay, it's just that how you understand it. It's correct also, it's not wrong. It's just that how you perceive the question. Okay, you want to provide rescue belt to be correct. I mean, if you press only, you want to give rescue belt. Okay, so the correct, most correct follow the context of the question is allow record. But actually, your rescue belt is correct. If you're doing 30, rescue belt. So it's how you perceive the question, that's all. Okay, it's not really wrong. But definitely yell for help is wrong. Remember they said the first one is just now, when you start first with compression, do not allow delay of 10 seconds. Okay, what you think is never allow interruptions, actually not wrong. Actually correct, don't allow interruption. But you see that now you're changing with someone, or you're going to move, or you're going to put a defeat, how fast you need to do it. So just before 10 seconds. That's all. So like I said, your fundamentals are correct, that's how you perceive it. There is definitely should never be interruption. Don't start to talk somewhere, oh the ambulance is here or not. No, okay, no. But maximum is 10 seconds between changing a person. Okay? Okay, this one, I don't think you know, you can do each of these. Okay, just choose one. Okay? The 5 cycle means 32, 32, 32, 32, 5 change. Okay? So what method you should use? Suspected head or neck injury. Head or neck injury. Jaw thrust, eh? Alright. Because if you push, neck will not go. So you just jaw thrust. Okay. Okay, handling definitely not. Handling is not even for having. They try to trick you because handling is it's so called heavy but it's tough. But there's nothing what to do with head or neck injury. Okay, so it's always jaw thrust. Remember if the friend has something wrong with the neck or accident, not try jaw thrust. Don't push it too much. When you see like that accidents and all the injury, you start bleeding around, then his neck, you cannot move the neck, the head injury but bleeding in the head. So you know that means perceive that neck injury is there. Because you know car accident, back, head is only cut, big. Then you know okay, that means definitely got neck injury. So do not try to push. So you just try to jaw thrust. So thrust it up. Tell me how you did. Push upward, outward. So upward, outward. So macam so dah dah. So the glottis tak ada tekan apa. Okay. After an AED is used, CPR is no longer necessary.
False.
Sure? True or false? Okay, why is it false? Okay. But sometimes the machine also is so is false. So what he's trying to say there is, even after using the AED is always resume the CPR, okay, for about 2 minutes until prompted by the AED to allow the check. So the AED didn't check, so breathing back, then the CPR will stop. So it doesn't mean the moment you put the AED already, you CPR, you just stand there and watch. No, that's not a video you watch. You will tell me, continue chest compression, ready to continue. So it doesn't differs really how many you do. So it tell you stop. Analyzing rhythm. So sometimes sometimes say, okay, there is then the submit already. So you CPR already. No, see, just don't do it, you just give back. Turn around. Okay. So for the questions, we're done. So let's just recap one more time of your, for example, in your school something happened. So always have a plan. Number one is get clear, paste the numbers of the emergency center. Like you already know, okay, 999. Get it. Know the nearest hospitals, for example. Know where your first aid kit is located. Okay, and always get to know one of the basic one important stuff is your students here, your teachers here, your fellow colleagues, what are their illnesses, what they might have. So for example, your child might have fits. So if something happened, you are back, okay, he has fits, you know what to do. Left lateral, what, everything, so you know. And always make sure that response is fast. In your health, you have that flow. When something happens, get someone, start checking, go to CPR and everything done. Okay? So that's the most important thing about it. Okay?
What do we do?
So what you need to do is left lateral. Left lateral will keep don't read, you should start checking. Okay? Okay? Anything else? Okay? So I think all good for today. Okay. So if any questions even after the session you can always ask. So I hope you all have benefited everything from the session. You can perform basic CPR, do your basic first aid for burns. You are well equipped now. Always check your emergency kit, making sure everything is in place. Once something is used, replace it, and expiry dates, keep it at a visible place. Every new teachers coming, you guys need to explain back to them, tell them best things, and keep it in a flow. Okay? Stay safe. Thank you.